Hello guys, I am Shanmugapriya, your lecturer from SNS College of Allied Health Science. Today we are just going to see a topic under anatomy, that is from osteology. Fibula as well as tibia. So starting with fibula, I just want to give an introduction about fibula. So basically this fibula is a long, slender bone in the lower leg, which is located laterally parallel to the tibia. It is also a non-weight bearing and it used to support ankle stability as well as for the muscle attachment. It forms the part of ankle joint with tibia and talus of the tarsal bones. And then going to the location of fibula, it is usually a lateral bone of the lower leg, extending from the knee to the ankle. So in the image you can see the bone is located on the lateral sides of the, so basically the lateral term defines the structures that are away from the midline. So this fibula is located lateral, that is away from the midline of the lower leg, extending from the knee joint to the ankle. And then the proximal end articulates with the tibia, forming tibiofibular joint. The distal end forms lateral malleus of the ankle and it lies within lateral leg muscles and lateral to tibia. Next, coming to the parts of fibula, the fibula has a proximal end and a distal end along with the shaft. So in the proximal end, we have a neck, head, facet on the head and apex. So basically the head articulates with the lateral tibial condyle and the neck which is a narrow region below the head, prone to the nerve injury. Facet on head for tibiofibular joint. It is pointed, the apex is pointed, superior tip of the head. We can imagine about the structure of fibula based on the given diagram. And the next we are just going to deal with shaft and distal end. Shaft, it is a slender triangular with anterior, posterior and interosseous border. So basically it consists of an interosseous border which is attached to the interosseous membrane which connects to the tibia. And the distal end, that is lateral malleus, forms the lateral ankle. And then distal end, distal end which is lateral malleus forms the lateral angle. Malleolar fossa, which is the attachment of the ankle ligaments. And then next we are just going to see the side determination. So based on the head, position of head, we determine, so this head is proximal. So it articulates with the tibia laterally. And then lateral malleus, which is a distal border, projects laterally. And also we have interosseous border which faces medially towards the tibia. It is oriented with the malleus inferior and head superior. And then ossification of fibula, we have primary ossification center. The shaft appears at the 8th fetal week. And then the secondary center, which is proximal and distal ends, 1 to 2 years. Apical closure, proximal, which is 15 to 17 years, and the distal 17 to 20 years. Clinical note, the growth plate injuries may affect ankle stability. And then we are going to deal with the blood supply. So basically, nutrient artery. A branch of perioneal artery enters shaft, periosteal supply and perineal anterior tibial arteries. The distal end, which is supplied by the branches of perioneal and posterior tibial arteries. Anastomosis we have around the ankle joint for the collateral blood flow. So these are the blood flow or blood supply to the fibula. And next, applied anatomy, we have muscle attachments like in the proximal end, biceps femoris and soleus. Shaft, we have peroneal muscles and extensor digitorum. In the distal end, we have ligaments of ankle and functions ankle eversion, foot stabilization.